All right. Thanks for Cameron for bragging about Staffordshire. It's great to see you again. A little South Park there for you. We are going to get going on the first presentation that I am going to be co-presenting. So let me figure out how to share my screen here, and we will let in our other co-presenters. How is everybody doing?
Fantastic.
Awesome. All right. Well, as you can see here, we are going to get going. I'm going to hide my floating controls there. If we want to briefly just introduce yourself and tell everybody which institution or affiliation you represent. Adam, go ahead.
All right. My name is Adam Antor, Assistant Professor of Professional Esports Production at Ferris State University in Michigan, USA.
Michele.
Hi, I'm Michele Pye. I'm the Division Director and Assistant Professor for the Division of Athletic Training at Shenandoah University.
And David.
My name is David Schary. I'm a professor of exercise science at Winthrop University, and I'm also the director of mental health and performance for Winthrop Athletics, where I work with our esports team.
All right, and we are going to have to do paper, rock, scissors to see who does the slides for Joanne and Joey. We'll throw them under the bus. All right, well, moving on to the next slide. See if there we go, figured it out. So this presentation on medical considerations and introducing the collegiate esports medical model came about from the second edition of the Handbook of Esports Medicine. Approached me about potentially writing a chapter, and so this is the culmination of that second edition book chapter. Brought in the hard hitters here of the collegiate medical space. And one of the main things that we try to focus on here is we're thinking about so collegiate / university esports players and their specific environment. They have prolonged sedentary behavior from seating, from gaming, which also involves the repetitive micro movements of esports gameplay, movement of the shoulder, movement of the wrist, also even static positions in a seated position. People know that university students have disrupted sleep patterns for various reasons. They're out of their normal home environment. They also have additional health considerations with exposure to blue light, from the screens. Because they're out of their regular home environment, they may have different eating patterns. And at least in the US, we love our buffets, and that seems to be pretty common in the collegiate space, where a lot of the dining halls have all you can eat. And you've heard probably the term the freshman 15, that is pounds, where people tend to put on weight just because of that change of environment and eating too much. And so what we've done here is we tried to develop what we have is a coordinated approach to care for the collegiate esports player that spans multiple domains in health across a university campus.
So kind of some background information on the collegiate landscape in North America, specifically, because that's where my expertise lies. There's two kind of buckets of esports programs at the collegiate level. There's varsity, and then there's club, which is much more student driven. Both have similar hierarchies, but the varsity side is staff driven, a little bit more resources from a personnel perspective. And they also might have a little bit better knowledge of the resources available to them and their students on a campus. There is a plethora of different positions that students and staff may hold depending on the institution, there are programs, varsity programs with one full-time staff member. Some might even have one part-time staff member, all the way to a couple varsity programs that have 6 or 7 full-time staff members. So definitely varying degrees of support. Go to the next slide here. A couple major esports leagues out there that students are competing in. They vary from a developer-supported league like CLOL or College League of Legends to more conference-oriented competition like the NECC or the NJCAAE. All of them are very sizable in the United States, and then there are even smaller ones that are more regional, maybe statewide conferences as well.
So the literature has identified common medical concerns within collegiate esport players that we have highlighted here in this table. And I want to draw your attention to the first column, which identifies the health concerns commonly seen in the collegiate esport population. This will include things such as back pain due to static posture and inadequate lumbar support, along with wrist, hand, and shoulder pain, which can be caused by repetitive micro movements. But we did move beyond just looking at the musculoskeletal pathologies, and we wanted to ensure that we included mental health or social issues, as well as sleep disorders and nutrition and supplements. And now I'm going to highlight that third column here, which provides suggested interventions based on the literature to prevent or restore these common health concerns that we see. These suggested interventions include on-site access to counseling, education for sleep hygiene, nutrition and supplements, and of course, ergonomic equipment for desk setup. And this table, again, was based off of what we've been able to identify in the literature with all of our sources cited in that fourth column.
So this is what we came up with as the Collegiate Esports Medical Support Structures model. And we will be discussing each of these separately. So take a quick look to sort of soak it in. I'm not going to go through all of them because we're going to do that in a second here, one by one. But you can see there are varied structures across a university campus that are commonly seen, that most universities, at least in the United States, will have variations of it. But some of these structures are not all based on a college campus. Some of them might be referred outside of that campus. So the first one would be exercise and fitness resource support. So this would be, a lot of times you'll see campus recreation and fitness centers where they might provide places for esports players to exercise. And the exercise can certainly help them improve their endurance, but also can help them be healthier so that they can game longer and try to prevent injury. So general health, you can't play esports if you're sick. And so by having improved health is going to benefit those things. At a rec center, you might have strength and conditioning coaches that can help support these players. If they're in the Department of Athletics, if the program is housed in the Department of Athletics, you tend to have even greater resource support in there. In a second, we'll talk about sports psychology support, but there might be certified strength and conditioning coaches and other types of performance coaches. And I think one thing you got to think about is trying to get player buy-in about exercise. And there's definitely more and more research, a systematic review that Craig McNulty and myself and a few other colleagues have done. And we're starting to see some of the benefits of exercise on cognition and tangentially esports performance. And so as we start to see more acute and longitudinal research to show that, chronic exercise can help improve esports performance, hopefully more players will buy into that, not just for health, but also for performance. Here is the American College of Sports Medicine's exercise guidelines for healthy adults. And really, this is a good starting point for players to consider aerobic exercise training and then resistance training, as well as flexibility training across a week. And here are, when we're looking at cardiovascular exercise intensity guidelines, based upon the amount recommended per week, here are the levels or intensity of exercise that people can figure out based upon either heart rate, if they're wearing a heart rate monitor, or rate of perceived exertion, or even verbal information about like somewhat hard to hard, extremely hard, the talk test. These are all different ways that practitioners can utilize to help somebody figure out what's the appropriate intensity of exercise.
I'll be covering Joey. We're throwing him under the bus today, as Dr. Jenny said. But it's our belief that really the director or the lead of the program has to set these healthy habits for players. We get a lot of students at the college level that don't know basic understandings or even what to advocate for when it comes to health. And it really has to start with the person in charge of the program. They don't need to be able to prescribe any certain habits or know anything medical related when it comes to that thing, but they should set guidelines and expectations. I know from experience from directing a program, like I had the ability to set expectations around how much sleep you should be getting or trying, or, hey, let's not go to the buffet and go back 4 times every meal. But also directors and leads of these programs have to establish the necessary resources within the program to support these healthy habits. So not just saying what they should be doing, but reinforcing those things. Organizing and executing an exercise plan for competitors within collegiate varsity programs is another example of something that directors could do. And there is research out there that shows this. The benefits of the things we're talking about, both in terms of lifelong or lifetime outcomes, but also their competitive outcomes. From the pedagogical and accommodation support section, there are numerous support structures in place at every institution for players. And some of them we've already listed and some we'll continue to list throughout this presentation. But counseling centers, there's usually personal trainers potentially in the gym or rec center. And the director should seek assistance in the execution of these plans. There's a report out there called the Trends Report that comes out every year that is fantastic. It reported in this report, it was self-reported that about 40% of esports programs in collegiate were under athletics. That number has actually drastically increased in the 2025 report. And in those departments, as we mentioned earlier, there's oftentimes other professionals that are hyper focused on certain aspects of medical side of things.
And I think, yep, Joanne, you're up. Go ahead.
Yeah. Just honestly, piggybacking off of what Adam just said, the medical care support, clearly on college campuses, we don't have multiple physicians. There's usually typically one primary doctor, especially if you have NCAA sports, you have a physician that oversees those sports. If you don't have sports on your campus, there is typically an academic healthcare center of some sort, but that's going to be your gatekeeper. And that's the person that should really be in contact with the person that Adam was talking about who oversees the team. They'll be your direct contact to say, hey, this person has this injury, they shouldn't play, or maybe the coach or person overseeing the sports team will say, I need you to go see this physician. But also not just for issues regarding esports, but just for overall general health. It's something that typically kids 18 to 19 years old don't think about, preventative care. So your primary care physician is going to be the person that should have a referral source. A college campus is not going to employ specialists, optometrists, psychologists, although most of them do have psychologists now, but there definitely needs to be a referral source for the primary care doctor to refer out. So the slide's a little bit busy here, but I just want it to direct you to the left side, the role of the primary care doctor. Again, annual physical exams, very typical of a college athlete that is sometimes overlooked with esport athletes. They manage, they can diagnose, they'll know where to send you. They even should know the services available on the campus. As we were talking about before, the athletic training surfaces, like sometimes communication can be an issue on college campuses, and sometimes a physician that works on campus might not even know that you have these resources available. So I would put that again to probably the coach on the team to reach out and find the resources on your campus. Again, the primary care doctor, vaccines, preventative care, and then specialists. Once you go to a sports medicine specialist in esports, they basically will go for preventative care, ergonomics, strengthening the right muscle groups. And then of course, actually the main component that most people complain about is ocular issues, and no optometrist is going to be on staff at a college. So they definitely find an optometrist that is familiar with digital eye strain and have a referral source for that, because most players don't even know when their eyes hurt or that they're blurry, that it actually can lead to medical condition, or that it is a condition.
To build upon what Joanne and Adam are saying, injury prevention on a college campus is really dependent upon these 4 key areas of continuum of care, an interdisciplinary healthcare team, key prevention tools, and rehabilitation and return to play initiatives. For continuum of care, prevention and rehabilitation in esports must be interconnected, which depends on that communication, which sometimes is lacking on college campuses. And we want that communication across our entire interdisciplinary team, as well as our medical physicians. That healthcare team will consist of everyone that Joanne was just speaking of, as well as hopefully an athletic trainer or physical therapist or occupational therapist or ergonomic specialists. There may be other healthcare professionals, but given the college campus, a lot of times there's not going to be a full accomplice of healthcare professionals, but you do need to have referral networks. So this team should utilize key prevention tools, such as pre-participation exams and ergonomic assessments that will help to establish the baseline health of each athlete and identify risk, as well as ensure proper setup and posture to prevent overuse injuries. Finally, for this slide, if or when an esport athlete sustains an injury, providing early intervention for rehabilitation and esport specific return to play guidelines that might emphasize things such as our ocular motor skills, reaction time, precision, and symptom monitoring is very imperative. And to support the injury prevention and wellness team, we want to also include our campus health and wellness centers. These centers should provide care for acute and chronic illnesses. They will have counseling and mental health support, as well as screening for hopefully vision or stress management, or at least be able to identify referral networks to the individuals in the community that might specialize for vision management. These campus and health wellness centers can also provide support for immunizations when teams are traveling in or out of the country and keeping records for medical clearance. They should also serve as hubs for our referrals to the broader interdisciplinary team, such as sleep clinics or nutritionists.
All right, so this is, as everybody else has been saying, kind of a continuation and builds off of everything else. But going from the physical health to the psychological health, there's really a few things that need to be brought up. You need buy-in, just like what we've been saying. And I have, at least from personal experience, seen that the mental side, whether it's mental health or mental performance, and we'll get to those two in a second, this has been a harder buy-in for a lot of the esports athletes than the physical health component is. So there might be higher barriers of entry when it comes to convincing some of the athletes or the coaches of the programs. Now, what you need to understand for anybody who's coming into this world, who is either mental performance consultant, sports psychologist, licensed mental health counselor, social worker, anybody who is in this space, that they don't have to, be an esports player or a former player, but they do have to understand the culture because it does differ from traditional sports, as we know. That's one thing that helps with the buy-in, that if you can speak the language, if you know the games, if you're able to relate on the players on that way, it helps to remove those barriers to entry. Now, with the campus counseling centers, most, if not all universities will have some sort of connection with their athletic department or with their club sport department. You want to go through those areas if you don't have somebody that is, if you can go back, Seth. Other direction. There you go. Perfect. Thank you. So starting with those campus counseling centers as the way to help. However, the counseling centers may not have specialized knowledge. So if they don't, and you don't have somebody embedded within the athletic department, then it is trying to make sure that you can provide knowledge to those counseling services, to the counselors that are there, so they understand some of the unique demands that the esports athletes have. And then finally, there with the applied sports psychology, enhancing performance, this is going beyond just mental health and helping with, let's say, anxiety or depression, and also looking at the performative aspects. Can you do goal setting, focus, attention, reaction times, these things that are important to the success of esports athletes that they may not necessarily understand or put priority on. So if you can talk that language and show how these mental skills can improve the way that they play their games, the better that they'll be.
All right, David, if you can talk about nutrition in 1 minute.
Of course. Yes, 1 minute. Very quickly, summarize all of nutrition. The biggest takeaways here are two things. One, as we said at the very beginning, that nutrition is often overlooked and on college campuses is not always the best. And so making sure that athletes, that these esports athletes understand how the nutrition can affect their performance. And then supplement use is really big. This is probably the largest area within the research, making sure that certain supplements, what they know that their side effects are. Caffeine use is something that I'll talk to athletes about all of the time because there's usually a lot of caffeine intakes, especially if schools might have sponsorships with companies like Red Bull or the likes, just understanding how caffeine affects their performance, but a whole host of supplements that are being introduced and marketed to these athletes that a lot of times they don't understand how it affects their bodies and their minds. So kind of helping them navigate that with all the information. And then these are the daily recommendations. There you go.
Nice work. All right, so in summary, here are our collegiate esports medical support structures. Obviously, some of the common themes that you've heard about is player buy-in is super important, making sure that you have somebody who's coordinating this. It's typically would be the collegiate esports director, but making the players aware of all of these resources on campus and not neglecting any of these areas, because when you've got some imbalance of health, whether it's the medical care or the nutritional support or the psychological support, if things move out of balance, then definitely things can move in the negative end, and you want to be proactive and try to get ahead of these types of issues before they occur, in developing a nice health-related culture within your program. Here are our references that you cannot read, but it shows the quality and the depth of our research. Here's some more. That is from the references from the book chapter. All right, moving into questions. So I saw we got one question in the Twitch chat, and Michele is volunteered to take it. Can you transfer that knowledge on injuries and rehabilitation in esports, as well as the measures, to normal office jobs?
Thank you for this question. And there are a lot of injury and rehabilitation based in esports that would transfer to our office jobs because of the desk setup or ergonomic setup of our office space. So there's a lot of information based on, the distance of our laptop screen or our monitors, as well as our chair height and how we should be sitting, which might not be how I'm currently sitting, that can transfer to any desk job or position where you're kind of sitting for a long extended period of time, because there's also a lot of information about breaks that we haven't been able to talk to due to time that are really important to ensure that we're not becoming sedentary in these postures and we're getting up, moving away, stretching our bodies in the opposite way to alleviate or prevent overuse injuries. But yes, it's very transferable to other office jobs. Maybe not all, but a lot of the information and research out there.
All right, I did not see any more questions in the chat. Is anybody else who's presenting now have any additional things you wanted to add?
I don't think we were allowed to give Joanne an introduction, so I want to make
Yeah.
sure she gets that opportunity.
And she just went off the mute. So why don't you say who you are and where you're from, and then give us some final closing thoughts, Joanne.
Oh, sure. So I'm Joanne Donoghue. I'm the Director of Clinical Research over at the New York Institute of Technology, College of Osteopathic Medicine. My last 6 years have been really based around esports research with metabolics and frequent breaks. Actually, speaking on what Dr. Pai was just talking about, most of my research has been based around taking frequent breaks. 6 minutes seems to be the magic number for cognitive health and for vascular health in this population. And piggybacking off of what we just said, how we couldn't talk about frequent breaks, I do want to point out something, how important exercise is for these players or for anybody who sits at a sedentary job. But keep in mind that it's not a replacement for taking frequent breaks. So even if you do exercise on a regular basis, taking a break at least every hour for 6 minutes can really make a difference in musculoskeletal health and vascular health. So as a matter of fact, the literature says that 90 minutes is really what it takes to negate prolonged sitting. And that's a very long time to exercise. So I would say the combination of incorporating exercise and the frequent breaks is going to play a big factor in future research and the health of the players.
Awesome. Well, thanks so much. I appreciate my co-presenters here. We are going to get set up for the next presentation. If you are listening in on the Twitch channel right now, please interact with these presenters, post questions in there. This is your opportunity. We're live, so we want to get those questions in, and we can try to share our knowledge. So thanks, everybody. Appreciate it.